Hi everyone, my name is Izzy Hicks, and I'll be doing a brief summary on selective mutism. So first of all, selective mutism is a type of severe anxiety disorder that can be characterized as freezing up or feeling completely unable to speak when you're in a certain social situation or setting, such as a classroom. There isn't one single cause of selective mutism, but it's been found to be related to the reinforcement of anxiety-based behaviors. It is more prevalent in females than in males, and 1 in 40 children are affected. Some signs you should look for when considering if you or a loved one may have selective mutism are being nervous, uneasy, or socially awkward, being clingy, excessively shy or withdrawn, stubborn and aggressive, avoiding eye contact, and tending to be rude or seem disinterested. If your child is struggling a lot in social situations, then they may have, and it has lasted over a month, then they may have selective mutism. Someone who has selective mutism would typically see a speech and language therapist, but if the person diagnosed is older or has had it for a very long time, then they may need more extensive help and should see a mental health professional. Some reliable and informative sources that you can use to learn more information about selective mutism are www.selectivemutism.org, first-person videos of children with selective mutism on YouTube, first-person articles about their personal experiences with selective mutism. I personally enjoyed an article called Josh Finding His Voice, which can be found on childmind.org, and a podcast called Loudism. These are all great resources to find out more about selective mutism. There are also different interventions that can be used to help children with selective mutism work through anxiety and fear of speaking. 2 that really caught my attention as being effective are Brave Buddies program and cognitive behavioral therapy. The Brave Buddies program is a behavioral treatment program that lasts 4 days long and is for children between 3 and 12 who have already been diagnosed with selective mutism. It's delivered directly to the child and simulates a classroom to give these children a realistic experience and provides guided opportunities to interact in a safe environment and practice verbal participation. Although it is expensive, it's very effective and includes the parents in the experience so that they can then go home and continue to help their children work through the selective mutism. Moving on to cognitive behavioral therapy, it's delivered directly to the child with selective mutism and uses exposure-based practices. It starts with minimal exposure, like hanging out with your parents and playing, and then works up to more high exposure experiences like playing with a teacher and your parent at the same time together. Then the child will get rewarded for reaching the behavior goal. The child would typically go once every 2 weeks or once every week, and does anywhere from 5 to 20 sessions. It really depends on how severe your condition is and how much you really need to work through it. Although this intervention is also expensive, it shows the most promise for helping children who struggle with selective mutism and has the most research to back it up. Luckily, there's so much information, resources, and interventions available for selective mutism. So thank you for listening, and I hope everyone enjoys their day.